Vincent, let's start off with the most important question about how Lyle is.
Lyle's been having issues with his mental well-being, and as a club we've very quickly, very naturally made the decision to fully support him, support his family, obviously offer him access to all the expertise and clinical support that he needs. And at the moment, I think for him, we're wishing him a speedy recovery, and we're wishing him to be in a better place by the time he's ready to come back to us.
People will naturally be sending all their best wishes and thoughts to him as well. As far as we as a club, but you as his manager, finding out, how quickly was that turnaround in terms of him coming to you and actually getting that help that he needed?
Look, we were very fortunate that Lyle had been very open with us. And from the moment he'd been open with us, we were able to act. So as soon as he said it, as soon as he showed signs of how severe it was for him, I think straight away the entire support team within the club just mobilized, and we made sure that he could focus on his own recovery. And you know, I think in moments like this you have to put the human first, and that's what we did.
And he's a long way from home, and I know that his family have been part of that support as well, haven't they?
Yeah, I think where Lyle is lucky, if you like, is that he has a very good network around him. He's got a very healthy, supportive family. He's got, I think, a club and people who not only want to help him, but want to help, not just for the player he is, but for the person he is as well. And look, we'll provide all the best care in the world possible to get him over his mental health issues. And I think as well, it's not something anymore of this world that is, you know, a taboo, if you like. It's something that if people speak up about it, they do get help. For us in the longer term, anyway, it's something that we would have had to handle. So I think now was breaking point for him, and now we felt that we could also show how much we're dedicated, not just to the players with us, but the people with us.
I know it's not an injury as such, it's an illness though. And within football, people always ask, when will he be back? What game will he be back for? Is it even possible to think about timeframes around this?
Well, I can't make those assumptions. I don't know. So I think at this moment in time, he needs support, and he needs to be with people who understand how to help him. And from that moment in time, I think we'll be, you know, whatever we do now will anyway be better for him if we put him first than if we do it in any other way. It doesn't resolve itself that way.
Just with regards to mental health, you mentioned the word taboo, and we've had these conversations as well, and trying to break the stigma around it. We know that at least 1 in 4 people will be affected by mental health in their lifetime. At any one time, 1 in 10 people are suffering with it right now. And in football, the PFA have shared that figure rises dramatically to around 75% of people, which suggests that, you know, there's very possibly he certainly won't be alone in football, and there's be other players around, other people around who are living with the same problems that Lyle has.
Yeah, I think, look, we're in an environment, football, which is not necessarily taken into consideration. And I mean, you know, when you go out there and compete, when you have the noise all around the game, which is, you know, people love this game, but obviously they all have an opinion. It's not necessarily an arena where it's designed to protect your mental well-being, if you like. You do get exposed to quite a lot of things, and as part of it, you're going through things in your own way. But I think we're trying to make sure we give him the best support we can, and at the same time, also we realize that within a large organization where there's hundreds of people working here at, you know, Burnley Football Club, it could be a player just like it could be a staff member. And I think we have to treat them, we have to treat Lyle as if he was a human being. We have to treat a staff member as a human being. That's the most important thing. And then you do come to the best way, I think, forward for the individual.
And I know we've spoken about this before, but we do have a psychologist working here at the football club that's not only available for the players, but every member of staff can actually go to him and talk.
Yeah, I think, especially in England, mental well-being is at a very high mental support for mental well-being is a very high standard, and I think the country and the league has got definitely at the forefront of what is being done to provide care for people. Now, I think we're doing everything we can to get him to a place where he can do what he enjoys doing the most, which is playing football, as soon as possible, because that will also affect his mental well-being, hopefully in the future positively again. But at this moment in time, he's one of us, and we need to look after our own.